The Success with Therapies Research Consortium is a group of clinicians and researchers from several care centers around the country who've come together to try and figure out ways to help people who have CF get more of their therapies done. We know that everyone has different types of barriers that can get in the way of getting treatments done. And even within one person, today's barriers might not be the same as their barriers in 3 years. And so our goal is to create a toolbox of different types of interventions that can help people get their therapies done for the barriers that they have right now. A barrier is anything that gets in the way of doing therapy. It can be anything from just being way too busy with life, with work, school, being with friends, or it could be as serious as having a major depressive disorder. There have been many different ideas proposed for how we can help people get therapies done. Our goal is to test them using scientific approach to see if they actually really work. So there are many different possible tools we could work on. It can range from having a counselor or a health coach work through some of the challenges that you're facing, or it could be an app on a telephone that helps support and gives reminders or makes life easier in terms of getting pharmacy refills. So the same as we have a drug development pipeline where we have to first in concept see if it works, and then we take it to full studies in very controlled research environment, and then we push it out to the general population and still test whether it works or not. We're going to do the same thing. Get some evidence that it maybe might work, we'll do a fuller trial, but then our ultimate goal is to then test the best ways to get it out to care teams and to families. So the first key place is to understand what challenges people are facing, so what barriers they encounter. So we're doing a study right now we did qualitative interviews with lots of patients and families and care team members, got a big long list of things that have been told to get in the way. And now we're creating what we call a checklist so that we can identify which barriers are the most common, which barriers are the most common at what age, geographically, which are the most common barriers, based on the type of insurance you have, which are the most common barriers. So then we can really hone in and try and figure out which barriers we really need to target right now. So now there are, with technology advancing, many exciting ways that we can measure without being intrusive. So same as we can measure our steps with our Fitbit, many of the devices are now getting what's called chipped and Bluetooths. So all a person has to do is take their medicines the way they normally would, and that data gets captured and sent to a storage area. So one big challenge with a rare disease like cystic fibrosis is that many people live very far away from their care center, and they don't necessarily live in a neighborhood where they have access to counseling, or maybe not access to counseling that understands CF. So one of our goals is to come up with telecoaching. Again, now the idea that we have Skype, can we use that technology to have a counselor at a tertiary care center who really is an expert in CF? And can we do these counseling sessions via telecoaching so someone doesn't have to drive hours in and take lots of time out of their day? Another thing we're testing out is an app called Med Action Plan. It's a commercially available app but has not been used in CF yet. And one of the ways it works is it gives your treatment regimen on your phone. And so if you're not quite sure what you're supposed to be doing, you can always look it up. It can also give reminders, so if you want to set reminders to do a particular treatment, say something new's been prescribed and it's a new habit you need to form, it can give reminders to do that. So CF Design is looking at taking a very effective in-person counseling program, an Education Plus counseling program, fabulous intervention that worked face-to-face to help young children gain weight and improve mealtime behaviors. So now they're building the larger platform so that it can be pushed out to all the care centers, so that hopefully we can make this available to everyone. So they don't have to be at a particular care center. Everyone can get access to knowledge and skills and have opportunities to practice and monitor and track nutrition the way they would have if they could have gone to this face-to-face intervention. So right now we're just getting our projects up and off the ground. We're really still at that formative phase of getting our feedback from our stakeholders to make sure we're on the right track. The next phase will be doing some pilot studies and then the larger trials. So we have to follow the scientific process of testing it and evaluating it, making sure it does really for sure work, because we don't want to waste anybody's time.